I'm Dr. Jelaine Bullock-Berquist, social media editor for Seminars in Arthritis and Rheumatism. Today I am speaking with Dr. Jason Kim, director of the Osteoarthritis Research Program at the Arthritis Foundation. He is the first author of an article discussing a workshop created to discuss the current state of research in osteoarthritis. This is available in the October 2022 issue online and open access. Keep watching for details regarding this workshop. Well, thank you for joining me, Dr. Kim.
Thank you for having me.
Awesome. So this is a great idea to bring together all of these different interested parties in osteoarthritis to discuss the current state of science. Can you tell me how this got started?
Sure. It was a process. The FDA had previously reached out to the Arthritis Foundation as part of their desire to encourage patient focused drug development. My FDA counterpart, Nikolai Nikolov, and I came together to collaborate on this meeting in 2020. So it took a while to get, all the cylinders firing. We had a lot of planning meetings and start to engage different uh, experts in the community. We had different representatives from diverse organizations in OA, such as ORZI, OMRACT, NIH, specifically the NIAMS Institute. And as the agenda was being built out, uh, the focus continued to shift and uh, and evolve to bring the right speakers to sort of tell this story in how do we better develop drugs for OA.
And can I just ask a couple of follow-up questions? How long did the workshop last for?
It was a short workshop. It was just a 1 day workshop. Initially, we had intended it to be an in-person workshop, but of course, that all changed, and we were just trying to be mindful of everybody's screen time.
What were the major findings or major concepts that came out of this meeting?
Yeah, I think there was a lot of reinforcement of concepts that maybe some in the community already know about. To agree that again that OA is a serious disease of enormous prevalence. OA is a complex disease, and it's further complexed by slow evolution, taking sometimes decades for symptoms to appear, and of course, various phenotypes or courses that the disease takes is a real challenge to the drug development process in terms of long follow-up periods, as well as the necessity for really huge, you know, uh, patient populations to be recruited. Um, and again, there's a lot of interest in this area on biomarkers and especially biomarkers as surrogate endpoints, which can open up accelerated drug approval for the FDA, that pathway for the FDA. So, of course, drug developers are very interested in getting that pathway initiated, as well as the foundation and the patients that we represent. But there's still some work to do for biomarkers um, to help you know uh, get that pathway moving. I think at the same time we saw this very timely activity of the Biogen drug that did get the accelerated drug development pathway approved by the FDA. And as you know, the Biogen drug is for Alzheimer's, and um, you know we know now that kind of rushing the process of
Mhm.
uh, biomarker development didn't work out so well for that drug or those patients.
So lessons learned.
Yes, absolutely.
Yeah. Is there going to be any other next steps in this collaboration? Any other work to be done from this group?
Yeah, I think there will continue to be these types of meetings convened, hopefully annually. The FDA is, reaching out to other groups to also partner with them. I think they're trying to be as inclusive as they can. Most recently, the FDA participated in an ORSI symposium on clinical trials that ORSI was also kind enough to invite me to as well. I think for the foundation, we would like to continue to push on more activity in research and drug development so that patients have more treatment options that they can choose from. We would like to see more meetings and discussions with the FDA on regenerative medicine, like stem cells and gene therapies and orthobiologics that are sort of trending these days and attracting a lot of attention from patients as well. And I think also an aspiration that we have at the foundation is to look at research beyond the knee, because we know that a lot of osteoarthritis research, which is all welcome, is very focused on the knee joint, and patients suffer from arthritis in all of their joints, and we would love to see more activity in the different parts of the body.
Which is great. I mean, this is great work, and you making sure that patients are at the forefront of our research is just wonderful for the Arthritis Foundation to be pursuing.
Yeah.
Well, thank you so much for joining me today.
Yeah, thank you for having me on.
For the complete article, please visit www.sciencedirect.com. If you're interested in more video content from seminars in arthritis and rheumatism, including more author interviews, please hit the subscribe button. Thanks for watching.